the violent criminal drug dealer standing on a street corner who gets to decide all the different aspects of how a drug is produced and distributed, right? How much he's going to sell the drug for, where he's going to sell it if it's going to be close to a school, what the purity is going to be, what it's going to be contaminated with, the means of advertising, right? Is he going to take little ecstasy tablets and stamp logos on them that will make it more attractive for young people, for example? So for example, in New York recently, we had MDMA that was being sold with little MDMA pills with the Twilight characters stamped on them, right? It's advertising, and this is what happens in an unregulated industry. Anything goes. So our argument is that the more dangerous a drug, the more reason there is to regulate and control it, right? Now, regulation does not mean that there's a free-for-all, right? That would be the opposite of regulation. So when you legalize something and you regulate it, you have different options in terms of how you're going to control it, right? And it depends on the drug. And I think what would guide politicians and bureaucrats in terms of coming up with regulations would be things like scientific evidence, perhaps. Public policy, right? Public consultation. History, historically what has been our experiences with those drugs, right? And so fundamentally what LEAP wants to do is legalize all drugs, regulate them, and everybody has their own opinions about how different drugs should be regulated. There's an organization called the Transform Drug Policy Foundation out of the UK that just published an excellent book. It's called After the War on Drugs: Blueprints for Regulation. And I often promote that when I go to these kinds of talks, because what they do with that book is the author actually sits down and suggests exactly how different drugs could be regulated, right? From marijuana to the opiates, like heroin and other drugs, to drugs that you would think would be more difficult to regulate, like the stimulants, cocaine, the amphetamines, for example. And there's lots of different options. Marijuana perhaps could be taxed and sold similar to alcohol is, with age and advertising restrictions. Heroin or the opiates, perhaps you could have prescription maintenance programs similar to what they do in Europe. I think the issue of stimulants is a more complex question, but those two can be regulated in different ways. Okay, so I'm just going to pause at this point, and that's sort of what LEAP is all about. I'll tell you a little bit about what I've been doing as a representative of law enforcement against prohibition for the last year. It's been an interesting year. And I'll just kind of start. I think I presented at the 10th Annual Cannabis Convention back in February last year. After that, in Victoria, the provincial government was holding a series of regional engagement sessions because they were trying to come up with a 10-year plan for mental health and substance abuse in the province. So I had the opportunity as a representative of LEAP to go to one of those sessions in Victoria, and that was really interesting. You had a whole range of people there, from government employees to drug and alcohol counselors, and we were able to give our input on a number of issues that the provincial government is considering. Over the summer, I had the opportunity to go to Pittsburgh, where I was on a panel called After the Shooting Stops, and I was in Pittsburgh at the Netroots Nation convention, which is a huge political convention in the United States that's held annually. It's attended mainly by progressive and democratic activists, I guess, in the United States. And especially those who are really involved in terms of technology-wise, right? So people that blog for the Democratic Party, people that tweet for the Democratic Party. I met one guy there who had 30,000 followers on Twitter type thing. So a lot of influential people were there. It tends to draw some very interesting political folks from the United States. Like, for example, Howard Dean was there. I got to watch Bill Clinton give the keynote address at that convention. So this is the kind of engagement at law enforcement against prohibition that we see. Generally, and it's not that we don't like anybody in this room, but generally we try not to come to places like this because we feel, for the most part, that we're preaching to the converted, right? The folks in this room already understand that the prohibition of marijuana or other drugs is a failure. Generally, we try and go places where people do not agree with us, right? So later that year, in the fall, I had the opportunity to testify before a Senate committee in Ottawa about Bill C-15. Thank you. And that was a really interesting experience too. I'd never done anything like that, and so I gave my input. I told them what I thought of the bill, and ultimately that bill did not pass. But I think we'll see sort of a reincarnation of that at some point. So that is another battle that will be fought down the road. And then throughout it all, I was doing sort of little one-off events, right? So I spoke at some of the Rotary clubs on the island, the Duncan Rotary Club, Langford Rotary Club, the Royal Oak Rotary Club, right? And generally, those are really interesting places to engage people because it tends to be perhaps older or retired folks, conservative individuals, or perhaps business-minded folks who might not have thought about sort of the harmful and destructive policy of drug prohibition. And it's interesting because I keep going to these Rotary clubs expecting to get shouted out of the room or something like that. And yet, I found they've all been really positive experiences. Obviously not everybody supports LEAP's goals at these kinds of things, but there's really good engagement and actually a surprising level of support for marijuana legalization or even other drugs. So those have been really positive experiences for me as well. And then yesterday, I was actually in Harrison Hot Springs at a conference called Resilient Communities. I was presenting on a harm reduction panel, and Resilient Communities is it's a conference for locally elected leaders. So city councilors, school board trustees from all over British Columbia. And so that was really interesting experience as well. And what I was talking about at that conference, harm reduction, was actually quite tame because usually I'm talking about legalizing crack cocaine. But again, the reception for the people that attended the panel was quite good. People are interested in this issue, especially at the local level. So that's kind of what I've been up to. I'll just kind of pause here, and perhaps if people in the room have questions, I would be, yes, Jody.
I'm wondering how did you come about with the sudden realization, or have you always known prohibition was a problem, or how did you join and get into LEAP?
Yeah, it was really gradual. Yeah, really gradual. I mean, I got hired perhaps a little bit older than some police officers. I got hired as a police officer when I was 27. So I had some life experience and held different jobs in the private sector. When I got hired as a police officer, my first couple of years on the road, I found that I was just starting to get really frustrated. Quite often, I was disappointed with arresting sort of the same very sort of low-level street addicts over and over again. The fact that I was arresting them was not curing their addiction or preventing them from committing further crimes. And so I began to think there must be some kind of other option here, right? Like, this just doesn't make sense. So I did some research on the internet on my own time, and it took me a while, but I stumbled across LEAP's website. And I was intrigued, but also quite nervous, because I wanted to make sure